Okay. In 2014, a case made national news headlines about a 29-year-old woman named Brittany Menard. Brittany Menard was a healthy newlywed woman who was just beginning her life and about to start a family. Little did she know that a few short months into her marriage, her life was going to consist of hospital stays, testing, evaluations, and surgeries. Brittany was diagnosed with terminal brain cancer and given a prognosis of 6 months left to live. If you've ever witnessed a loved one go through cancer treatment, you would know it's not something that you would wish upon anyone. And because Brittany was 29 and otherwise healthy, her doctors and her both knew that her body was going to try to drag out the process longer than necessary. So because the end was inevitably going to unfortunately be the same, who was to tell Brittany that she had to endure a long, dragged out process of death? Brittany died on November 4th, 2014 from physician-assisted death. Physician-assisted dying is a highly controversial topic that many do not support. The arguments and concerns around it are both very valid, but today I'm going to be talking about why I am for PAD and why I believe it should be legal in every state. So what is physician-assisted death? According to the Journal of Oncology Practice, physician-assisted death is the practice where a medical professional knowingly prescribes a lethal medication to a terminally ill patient who has less than 6 months to live. With the medication in hand, the patient then has the choice to either take it or not take it. The concept of PAD is just autonomy and having the choice if you want it. So physician-assisted death differs from euthanasia because euthanasia, according to the American Journal of Psychiatry Residents, is the process where a physician injects a lethal medication with or without the patient's consent. Euthanasia is illegal in most countries because of this, but physician-assisted death is actually legal in 8 of our United States right now. In the 8 US states where it is legal, these states have laws that are called death with dignity laws. These laws stem from the idea that when it comes to making end-of-life choices, it should be your decision and not the government's decision or politicians or religious leaders. It should solely be your personal decision. Everyone should have the right to die with dignity and choose how much pain and suffering that they can endure. So let's talk about some of the common reasons that a lot of people are against this concept. The first one that comes to my mind is religion or faith-based reasons. So I am a Christian, and it's a very common belief in our community that suicide is considered sin and that it's kind of playing God. This is a valid reason. However, this argument is also a part of the whole separation of church and state. In this country, I have the right to talk about my religion and discuss it with other people if they are open to it, but it is absolutely not my job to tell other people what they have to do with their body based on my personal values. So again, it's just giving everyone a choice. And then another argument is that patients could make a spur-of-the-moment decision or a decision that they might regret if they choose to follow through with physician-assisted death. This is another valid concern, but it's also why the process is very lengthy and honestly quite complicated. The patient has to go through multiple evaluations, even mandatory therapy and waiting periods to make sure that the patient is in the right state of mind, and that they are competent and know kind of what's going on. And then another concern is the legality of protecting the physicians. Physician-assisted death makes it easier for physicians than euthanasia because they're actually not the ones physically committing the death. They're simply providing the means for the patient to do it in a safe setting. Because of this, it is completely the physician's right on whether or not they want to partake in death with dignity. In the 8 states where it is legal, not every physician there partakes in it. It's a personal decision for the physicians as well. So because of this, it's very limited to find a physician that will work with you, and where you can find someone that will work with you and as well as you qualifying for it on top of it. So it's really not that common. But because it is only legal in 8 states, in the case of Brittany Menard, she had to up and move her entire family from California to Oregon because it wasn't legal in California. So she had to gain residency in Oregon and go through an even longer process. Whereas I believe if it's legal in every state, it wouldn't be that complicated and hard on the whole family. So in conclusion, I support the idea that every individual should be able to decide for themselves if they want to pass away in their family home surrounded by their loved ones rather than in a hospital hooked up to machines, if that's something that they want to choose to do. So I hope I was able to teach something or leave you with something to consider. I'm not forcing my opinion on other people, but these are just the different viewpoints to this topic. And then for one of my visual aids, I have a political cartoon. So it's a political cartoon of a terminally ill patient hooked up in a hospital to machines, and a bystander saying that they're uncomfortable with the idea that assisted death, or also sometimes called assisted suicide, makes her uncomfortable, whereas the patient is kind of thinking, what does that have to, like, what does your opinion have to do with me and what I should do for myself, essentially. So again, it's just coming around to that whole idea that we should all be able to make choices for ourselves. Um, Okay, well, I can't figure out how to get out of this, but thank you for joining into my speech today. And I hope I was able to leave you with something to think about.